Good morning, everyone. Welcome to the collective stage. Can you read what it says here? Collective action. This session is about collective action. We have an amazing lineup of speakers, panelists, 65 minutes of high energy and positive change. My name is James Bidwell. I'm your moderator. I run Reset, which helps organizations think about innovation, sustainability, and disruption to drive positive change. We've got 65 minutes together. First, we're going to have a great keynote. Then we're going to have a panel for half an hour with some extraordinary participants. And then I'm going to have a fireside chat with one of the most influential people in insurance in the world. So we have lots to look forward to. Do not leave halfway through, please. Please read what's going on here. This is one of my favorite stages at ChangeNOW. Before we start, can I just ask you, please, to give a round of applause to the volunteers and the ChangeNOW team, because they're amazing. I hope you're listening, volunteers. So we're going to start today. We're going to talk about adaptation, the cost of inaction. I'm going to try and make that a little bit more positive about solutions-driven, which is what ChangeNOW is all about. And we open with an extraordinary keynote speaker, Kathy Baughman McLeod, who is the CEO of HERA, formerly Climate Resilience for All. And HERA is a woman-founded and led NGO dedicated to protecting the health, income, and dignity of women on the front lines of extreme heat. And this is not going to be much fun, this keynote, to watch, because it's very, very tough out there. And Kathy has the most amazing experience at the intersection of climate risk, finance, and frontline communities with organizations like the Nature Conservancy, the Bank of America, and now HERA, where she's immersed in women-led adaptation programs across India, Pakistan, Thailand, Sierra Leone, and more. And it's not surprising when I was reading her bio that she was named amongst the Reuters top 20 trailblazing women in climate in 2024. Amazing treat in store. I welcome Kathy Baughman McLeod.
Thank you, thank you. Good morning. Can you hear me? How are we feeling? I feel the energy. It's very positive. You're going to need it. I'm Kathy Baughman McLeod. I'm the CEO of HERA, and it stands for lots of good things. And our mission is to protect the income, health, and dignity of women on the front lines of extreme heat. And I'm going to tell you a couple of things about extreme heat you may not know, and then I'm going to tell you a story. Extreme heat is killing more people than any other of the climate hazards, and in often cases, it's all of them combined and still killing more people. It's silent and invisible. And one stat you can put in your pocket and take it with you, and people will love you at a dinner party. One person dies every minute from extreme heat on this planet. Think about that. And heat does not hit people equally. Women are disproportionately burdened by extreme heat, so are seniors, children, people with disabilities and underlying conditions, and poverty drives so much of underlying vulnerability to extreme heat and other climate hazards. And so I want to tell you a story that illustrates what is often an invisible story. And this story is about Gita Ben. Can you see Gita Ben? I don't see my slides. Do you see my slides? No. Yep. There we go. Okay, great. I thought you could see the slides. All right, so I now have this. Okay, so I shared some of that, and so now meet Gita Ben. Gita Ben is a head loader. Who here knows what a head loader is? I mean, it can be intuitive. Raise your hand if you know what a head loader is. Okay, Gita Ben is a head loader in a big market in Ahmedabad, India. And in this market, there are 2,000 head loaders, and their job is to move equipment, gear, goods from wholesalers to retailers on their head. And because of Gita Ben's low status, social status, she can't wait inside to take the next load down to the retailer. So she waits outside. And on May 26th, 2024, it was 49 degrees centigrade in Ahmedabad. And in the market, it could be hotter. This is what the weather station told us. And so she waited for the client to call her. She got the call. She put the load on her head. She stepped out to go down the market, and she collapsed from heat. She broke her leg. She hit her head, had a head injury. And the fabric she was carrying on her head was damaged by the mud or the dirt that she dropped it in. So she's responsible financially for half of the value of the fabric to her client. And now she's broken her leg and hit her head, and the public hospital was too crowded to take her, so she went to a private hospital. She got her legs set, she had an IV, she had her head checked, and she had to take a loan to get that medical treatment. And she needs to take a loan to pay back her client, and that's gonna take about 2 years. And the interest rates that she has to borrow at which she borrows are exorbitant. And so now she is out of work, so she doesn't have money for food. She has owed this new debt in 2 places, and she is set back substantially, and this is extreme heat. Now, the good news, she is a part of a program, a partnership that HERA has with her trade union called the Self-Employed Women's Association. And the Self-Employed Women's Association has 3.4 million women in the informal sector, like Gitabin, in other trades. And we partnered to bring an insurance that pays Gitabin when it's too hot to work and her health is threatened. And so on this day at 49C, absolutely, the insurance triggered, it's called a parametric insurance, a cash layer that triggers at a lower temperature also paid to her bank account. So she got 2 payments, one from insurance and one from a social protection, a cash layer. And so she had enough money to pay off the medical debt, to pay most of the debt to her client, and to eat for 3 weeks until she could come back to work. And so I tell that story to help exemplify what extreme heat looks like now I'll tell you, there are 772 million women facing extreme heat in the informal sector. They are in places all over the hot world. Now, places not accustomed to heat are also experiencing heat. So places like Sweden, the Netherlands, Norway, Iceland, all are experiencing higher temperatures. And when those big spikes of heat come and societies, governments aren't ready, they have catastrophic effect. So back to the 772, these are informal workers in the informal economy. If you add women facing extreme heat in the formal economy, that's more than 1 billion women. Women living on the poverty line in Lake Charles, Louisiana, in the fishing and fisheries industry, they are also facing extreme heat. And so if 1 billion women, and this is just the women, are facing extreme heat, this is a massive, massive issue, and so often misunderstood, little understood, and invisible. And so our mission, as I said, is for us with our partners to bring solutions, and this is what ChangeNOW is about, bringing solutions for women working. And we know that women need income because women are putting 90% of what they make back into their community. And gentlemen, I'm going to give you a number, and this is not to a person, but men are putting 40% of what they make back into their community. And so if you are making investment decisions, where would you put your money? In women. And so let's talk about some of the structural barriers to addressing extreme heat. just knowing that heat is an issue. Do you understand heat? Do you know how dangerous nighttime temperatures are? Lots of informal workers are living in housing with metal corrugated roofs. Those roofs are holding heat at night and emanating them into the house. And how many people have had a sleepless night and you wake up the next day feeling terrible? You're dragging to work, and this is the condition every single night. And as you watch the number of days and nights that rise above 35, 36, 38, and 40 across the global south for now, this means that it's an economic crisis as well as a health and social crisis. And so understanding heat and the way heat is landing on different people in different places, nighttime temperatures, cloud cover, 1 day of heat and 2 days later, same heat, you have less death and sickness. If you have a cool day and then a hot day, more death and more sickness. And if you are in charge of students, children, construction working teams, sports teams, and you don't have that literacy to know, you don't have the right tools at hand to help protect the people you're responsible for. And so these tools exist, and we have to build them. The built environment, as I mentioned, the corrugated roofs, concrete, steel, the homes in France. France has had immense death from heat because of the building stock. It's not made for heat, it's made for cold. And so seniors in attics where it's hotter, 52,000 people died in Europe from extreme heat last summer. And women are twice as likely to die in Europe from heat than men. And so next, data. This one, we always need more data, but this is data about people like Gita Ben. We need to understand what's happening for her body. And seeing some of the technology that's coming is wearables. We can use a Fitbit to really know what's happening for her physiology versus what the weather station at the airport tells us. And so if we make an insurance policy that triggers to pay her based on a weather station at the airport, and the airport says that it's 42, and she's standing on the black asphalt in the market, and the sun's coming down and the heat is emanating off the black asphalt, she's experiencing 47. We don't have a data source that tells us that. So one of our biggest ambitions is to change that so that we can get the data we need to calibrate the right tools and supports and financial products for people facing extreme heat this way. Governance and coordination. Heat waves should have a name, just like a hurricane. We tested naming heat waves in Spain. Heat wave Zoe was the first officially named heat wave. Our peer-reviewed science shows that it works. Governance for heat, the way we have governance for other climate hazards is essential. Gender bias. I think I've exhibited that in our few minutes already, but the data shows it. Science is biased against women because there's not financing for those analyses that let us understand the differences and disaggregate the data. And so oftentimes studies perpetuate that bias unintentionally by very good respected scientists, and we can address that. Lastly, finance. Some of it is insurance, some of it is microfinance, some of it is big investment into infrastructure that helps protect people while they're working and living, and we know what to do there. And so some of those financial mechanisms and flows are beginning. And so there are several sessions on adaptation finance here that will address extreme heat. African cities. I know that you expected to see Eugenia Cargbo today, and I'm very sorry. She's my colleague, the Chief Heat Officer of Freetown, Sierra Leone, and a member of the team at HERA, and her visa did not come in time, so I'm a very sorry substitute for Eugenia, but I want to talk about African cities. We know that they are both the place of rising vulnerability and the place of opportunity where so much innovation, new financial mechanisms and models are happening. And Freetown is the best-in-class heat action plan of Africa, the first and best. And so we're helping replicate that with new techniques, which I want to tell you about here. What are the things we can do, the solutions. So heat health education, talked about how important it is that we understand the relationship between health. How do you recognize the signs of your own body if you are suffering from heat? Do you know that if you went out for a run and you thought, I'm healthy and yeah, it's warm, but do you know when you start to feel sick and nauseous, if you stop sweating, you're in trouble. Get to know your own heat risks. Financial literacy, and these are all components of this heat action plan and what every good heat action plan should have in it. And these things are sourced from the community. This is not something that is a top-down document. This is something that comes from mutual work. Financial literacy, understanding the way that heat is hurting. And one of the things about Freetown is that the women in the markets in Freetown, the informal markets, are losing 60% of their income to extreme heat. That number really helped us know what are we dealing with here and how are we going to bring some solutions. And so shade, it seems so simple. It's not genius. We need shade. We need shade that the air flows through. We need shade with solar power for fans. We need lights so you can trade at night when it's cooler. So many markets and so many cities move to the night. And then we also need the renewable power, of course, that powers all of that, and especially need cold storage. One of the things that happens is that the fruits and vegetables that the traders are buying and sell, they go bad before they can sell them. It's so hot, so the merchandise they have has gone bad, and they themselves feel sick. They don't have cold storage. We can solve that. And with an early warning system, you would know that I'm going to buy less to sell because it's so hot. I know that my foot traffic will be down, and I have cold storage, but I'm not going to lose as much stock if I buy less because I have an early warning system tailored to me and the way I take in information. And when we don't disaggregate how early warning systems are delivered, we don't reach the people we want to reach. And so it's a pretty simple step. Lastly, this creates job growth. We have a new program that will bring that insurance that Gitabin has to the markets in Freetown. And we have just hired 8 women in every market to learn how to enroll women in the insurance program. They make a very small contribution to it. We bring philanthropy for the rest of the cost of the insurance, the premium. And so we make it very affordable. We do lots of education around it. And lastly, I want to re-emphasize our motto, strength in a hotter world. Thank you very much for coming today. Take care of yourselves. Stay cool. Thank you. Thank you. Thank you.
Wow. Thank you, Kathy. That was amazing. I'm back with renewed energy. That was pretty sobering, and 52,000 people who died in Europe last summer. And I don't know if some of you guys go on down to the Mediterranean and places for your holidays. It's seriously hot down there. We're seeing it happening here, and it's much worse in other places. Anyway, so there's lots to do, and I'm now going to have a conversation with 3 amazing panelists. So I'm going to welcome them to the stage. First of all, Sandrine Bouttier-Stref, the group head of CSR at Sanofi. Big round of applause, please. Sandrine, welcome. Secondly, Rémy Estran, who is the CEO of Scientific Climate Ratings. Welcome, Rémy. And Oxana Meggle, who is the Nature and Finance lead for the World Bank. So we got the money here, guys, so we need to understand what's happening. So this format is I'm going to ask the panel one by one to just give us a little bit of context, and then we're going to dig in and see if we can explore this topic, link some of the threads that we've heard from Kathy's amazing keynote, and unlock the adaptation imperative a little bit more. So my first question to you all is, why are you here? And please take the opportunity to give a little bit of context. I start with Sandrine.
Thank you. Hello, everyone. I'm very delighted to be there because I'm Sandrine. I'm the Global Head of Corporate Social Responsibility and Sustainability at Sanofi, which is a big international pharma company. And so every day we are working on our adaptation of our business model to the effect of climate change and more broadly on the environment, the impact on the environment, on the health of population and the healthcare system. And I have a second role as well, which is a general delegate of Sanofi Foundation. And so every day also we are working on the resilience of local communities in countries mentioned by Cassie before, suffering of the effect of climate change and particularly rise of temperature.
Amazing. Thank you very much. Rémy, I'll pass to you.
Thank you. And, welcome everyone. So I'm Rémy Estran-Fraioli, the CEO of Scientific Climate Ratings. We are born from the EDHEC Climate Institute research ecosystem, and we are a climate risk rating agency 100% focused on the assessment of the financial materiality of climate risk. In practice, what we do is that we integrate climate risk data into financial valuation models to estimate how climate risk, like transition and physical risk, can impact the revenues, the cost, the cash flows, and ultimately the financial valuation of the asset. Maybe one important thing is that we are not exactly just a data provider. As a rating agency that will be supervised and regulated by the European Securities and Market Authority, we actively engage with the rated entities. We notify them of the report. We provide them with the rating report. We give them an opportunity to review the analysis before publication. And it means that we have a very good understanding of the adaptation and resilience measures that are implemented at the asset level. And as we'll discuss later, this can be a game changer. So, long story short, I'm here to help move the conversation from climate awareness to investment decision, because I do believe that adaptation is also a matter of how capital will be allocated.
Brilliant. Thank you very much. We're looking forward to hearing more about that. Oxana, you work with the World Bank. Give us, please introduce yourself and why are you here?
Hi, everyone. A pleasure to be here today. I'm Oxana. I'm part of the World Bank Group Infrastructure Division, and I'm here today because adaptation is core and it's an intrinsic for the development. And as Kathy mentioned, the least people who are more vulnerable, they are much more impacted by the need to adapt the economy and the infrastructure. And the World Bank doing several types of activities in order to include the adaptation into all types of activities. First, we are embedding the adaptation into the development policies. We are scaling public finance for adaptation, going from disaster relief to preparedness and preparing the infrastructure and systems, human communities to the climate change effects. We are also scaling up private investments into adaptation. And finally, we are shaping the financing of the projects which address the climate effects. And there are several important reports which we have published, in particular Rising to the Challenge, our flagship report, where we address what has to be done in order to mainstream adaptation.
Amazing. Thank you very much. I'd like to dig in a little bit to the financial side while you guys are, just fresh from your intros, and just talk about how an adaptation business case would be made. Give us some examples of, because it's a nice idea, and we've gone through mitigation and monitoring and all of that, but we're now in a more proactive and positive expression of adaptation. How does that look in a financial business case? And who are your key stakeholders that you're talking to? Do you want to, Rémy, you're nodding. Do you want to talk a bit about that and how that's actually working and some examples?
Yes, how to move from reactive to proactive adaptation. So basically,
can I just stop you? Can everyone hear? At the back? Yes.
Yeah.
Okay, good.
Okay,
keep going.
Cool. Thank you.
I can't hear much, but anyway, that's okay.
So to move from reactive to proactive adaptation strategy, I think we can follow 4 steps, basically. The first step is the exposure assessment part. And so based on where the assets are, they might face hazard like flood, storm, heat waves, wildfire. That's the exposure assessment. And then the second step is that based on the asset-specific vulnerabilities, the asset type, this exposure can be translated into financial and operational impact. It can be direct damage, increasing the repair costs, or business disruption, reducing the revenues. And this combine this cost of inaction. I mean, the financial impact of climate risk is what we could call the cost of inaction. It's something that is expressed in concrete monetary terms. And then once we have estimated this cost of inaction, we can put in place some resilience and adaptation strategies to lower this cost of inaction. Here, there is no one-size-fits-all solution. I mean, a flood wall can be highly relevant for one specific asset at one specific location, yet totally irrelevant for the very same asset in another location. Yep. And so then, once we have estimated the benefits of these strategies, the losses they help avoid, then the fourth step would be to basically make an investment decision based on your risk appetite. I mean, sometimes the cost of reducing or eliminating a risk is higher than the cost of the risk itself. For example, a flood wall to protect a 500 kilometers long coastal road can be higher than the cost of the road itself. So it all depends on economic trade-off and social and financial benefit in the end.
So from our perspective, the cost of inaction is not least expensive when we think about it. The availability of the financing now and here just determines if the adaptation happens early and efficiently, or if it happens late and expensively. So we know that investing and making the financing available for adaptation is a challenge because the core benefits of adaptation are perceived very strongly as the public good. Therefore, currently more than 90% of the financing for adaptation measures in the countries come from the public pockets. How to make the private sector look into the adaptation and make the financing available for this objective? Well, we think that there are two ways to do that. The first one is to build strong business case, look at the financial return on the investment into adaptation. And we have been working in particularly with Rémy and scientific climate ratings, with some other partners on the business case report, which will be coming out very shortly. How the business case of investment in adaptation in infrastructure. So the business case really demonstrating the financial return on the investment is in very practical numbers. It's one thing, and that's what's missing very often because we are talking about every dollar invested in adaptation will generate $10 of return. This number circulates. It has been available for some time. But we wanted to look specifically in some specific assets and see in infrastructure sector, in transmission and distribution, in water, in roads, how much would an investment bring in terms of return on the investment. And the second area of activities, in addition to the business case, it's available innovative financing structures, such as the ones which privilege the schemes which potentially increase the payment from the users, from the government, or which value the land value capture. So innovative financing structures which already exist but which need to be scaled. That's another way to bring the private sector into the adaptation finance.
Amazing, thank you. So that's, for me, that's, gets to the point of the title of our talk, is this, doing the business case for the cost of inaction and then doing the business case for going forward. And you talk a bit about working with the private sector, so it's a very nice segue into Sandrine, and you have a slightly different take on this because you're in the health space. What's Sanofi doing, and how are you thinking about it? How are you funding some of this work? How excited are you about adaptation as a theme within your business?
So maybe I would like to start by a few figures that are quite edifying. So we know that the environment, and not just climate change, because it's a triple crisis, pollution, and particularly air pollution and water pollution, climate change, rise of temperature, rise of the seas, and extreme weather events, but also biodiversity loss leads to harming the health of population wherever they are. And in addition, they also impact the healthcare systems worldwide. So few figures, not all figures, but so in the next 20 years, we expect to have around 15 million deaths additional because of the environmental impact, half of them due to respiratory disease, meaning the air quality. That means that at huge economic impact, we assess around $12.5 billion the economy loss, and additional cost for the healthcare system around $1.1 billion every year. So with those figures, we need to react, not just because of the financing of the economy loss, but because so much people will die about the effect of environment. And this is what we are tackling, particularly at Sanofi. Our sustainability is very focused on that topic by gathering data, and real-world evidence are absolutely key to understand the mechanism between the environment and the health of population, but also to understand how it will impact the population in their daily life and also the healthcare system. So first, gathering data, scientific burden in order to showcase to institutions, governments, and population communities how it is urgent to move forward. Second is also to develop solutions for the health of population in the future, having a new model of delivering the health. I didn't mention, but the healthcare system is overwhelmed, as you mentioned, infrastructure during this kind of extreme weather or heat waves, because workers, healthcare professionals can't reach the hospital, more patients suffering of cardiovascular or stroke coming at the hospital, and all the system is collapsing. And we have not the answer. We are not prepared, and anticipation is absolutely key. So this is why we are discussing about mitigation, working on the root cause of the problem, but also to be prepared to face the problem that it will come very soon, and it is already there. So from a business perspective, so we are working with our R&D to develop new ways of delivering the care to people and limiting the impact on the environment, but also we adapt. You know that some pharmaceutical products or vaccines must stay in a cold condition. So what about this cold chain during route if the temperature is rising by 2 or 4 degrees? We need to think about that. What about the stability of the products if the temperature is rising? What about the delivery if the boats or the trucks can't reach the right population? So this is an adaptation about our products, the way to deliver care, and so working with healthcare professionals on that topic, and with the healthcare system, meaning insurers, care providers, payers, professionals, and some others, in order to think differently the care of tomorrow. So this is globally what we are doing. And last but not least, we are also working with local communities on the field, and it is absolutely key. With the Paris Agreement, it has been decided to create a fund from the north to finance the south to find solutions. But we put in place funding, in place it's not the right word, but so we have not the solution. So we need to think differently. We need to innovate. We need to find the best solution, and who more than the local communities can make it. It's really with them. We need to put the communities in the driving seat in order to shape and design the right solution. And we used to say that it's not just public and private partnership or coalition to find the solution. It's now public, private, philanthropic, and population solution. So this is broadly what we are working on.
I mean, first, congratulations for amazing work. And one of the things I always find about ChangeNOW is we have someone like you guys telling us about these things that are actually happening and giving us a little bit more hope than maybe when we arrived. And I do have a question about how you communicate this, and how far will you diverge from the profit side of things? So stuff that's in your business model to make you more profitable, to make strategic decisions which may not be so profitable in the short term, that may, that are going to have the positive impact in the long term. So how do you think about that from a financial point of view at Sanofi? And then I'm going to ask you guys the same question.
So we are not speaking just about funding. We are coming with solutions that are designed with people fully involved. So I'm leading an international public and private and philanthropic coalition working all together to influence, to shape policies by demonstration. And once again, real-world evidence are key to showcase that this solution is the right one. So there is an emergency. We need not just only to wake up call, but also ask to walk the talk. There's so much people speaking about the topic, but we need to act now. It's no more blah, blah.
Well done.
So we need to move forward.
That.
And so this is a claim that we are making in different countries.
Yep.
It's not easy. Very honestly, it's not easy. But I think that if we are collectively in the same way, working with the same movement, we should achieve the goal. And so supporting from the local and the field to the top, and so changing the mindset. This is why it's important to move forward all together. But so we need to stay humble. The task is super huge, very complex, but we need to start now.
Yeah. Thank you very much. Amazing. And I keep looking at this collective action thing behind me. We need to keep an eye on that, because that's the point, isn't it? We're going to do that together. And Oxana, you're working with all sorts of stakeholders. Talk a bit about this relationship between short-term, long-term, and are you feeling positive in terms of how people are kind of acting and how strategic they're being with their money, and what you're also funding?
So probably the key topic here is the partnerships, because adaptation is, on one side, it's an action, it's changing the systems, the way people operate. So it's a lot about change management. And on the other side, it's about the long-term development, and it's about bringing together a lot of partners. So one of the examples of the activities which we have been doing is to support the municipalities and the cities on the disaster relief and on the management of the flooding. So the issue there is, how do we bring together the landowners? How do we bring together the technology providers? How do we bring together the financing institutions, development institutions, and insurance companies? And how do we address the message to each single stakeholder on the importance of the action? So we think that adaptation is really the key for making people's jobs safe, making people safe in general. And to do that, we are trying to adapt the message to the stakeholder we are talking with. In particularly when we speak with the financing institutions, when we speak with investors, we speak about the business case. And adapting this language, demonstrating that adaptation is not only the core benefit, but it can actually drive the job creation, it can drive the increase of the living standards, it can have a strong impact on the health, it can have the strong impact on the balance sheet, it can generate returns. That's the way we are trying to address that. And we also do a lot of work bringing together the stakeholders in different countries. For instance, we have national adaptation plans. We work with the governments and the ministries on development these type of documents, which help to identify what are the priorities at the national level, similarly to the reports related to the climate change. So that's the way we are trying to convene and influence this agenda and speak the language of the stakeholders.
Brilliant. And Rémy, with your analysis and the work that you're doing, short-term, long-term, kind of want to make money quickly, you know, or want to invest for the future, how are you, and how do you work with those kind of partners?
Yes, sure. The thing is, finance can be seen as a bridge between the present and the future, because basically finance is about allocating today's funding to tomorrow's project. So in this sense, it has a very important role in shaping tomorrow's world. But the thing is, those allocating funds, the asset managers, the institutional investors, they have a fiduciary duty, meaning that they can't act simply based on climate concern or societal benefit. So that's why climate risk, like any other kind of risk, must be quantified financially. And then once it's quantified financially, then it can be integrated into financial decision making, and particularly if you want to bring private capital into the equation.
Yeah.
So.
Okay, no, that's a good answer. Thank you. So I wanted just to switch. We've got only 6 minutes left because this always goes too quickly. But thinking about innovation and, you know, you guys have seen the pitch stage. It's like there's 10 or 20 new businesses, new solutions every hour. And, you know, ChangeNOW is kind of about solutions. And thinking about solutions for adaptation, there's loads of, I've been watching, you know, fantastic ideas. How are you harnessing that, and how much of the solution to this agenda is innovation and these kind of new businesses emerging and the startups, and how do you manage that within your kind of ecosystem? Sandrine.
So from a business perspective, we used to innovate every day for patients. So we push more for this kind of innovation and think completely differently. And so we are asking our research and development to, once again, to think how we can treat patients differently in the future. Care at home is a good example.
Yep.
So we made studies to assess what is the environmental footprint of the care pathway for a patient, from diagnosis to treatment, complication, hospitalization, in some cases, and monitoring. And so we identify 7 levers we did not expect. Just to give you one figure, the healthcare system in the world is average 5% CO2 emission, twice airlines. It's huge. And on those 5%, 45% are the care pathway. So the pathway of the patients, all the system, care providers, insurers, payers, hospitals, and so on. So we have identified 7 levers along, and so we need to innovate on those 7 levers. More digital. You will say about digital as an environmental impact. So we made studies, once again, real data, showcasing that it's a better outcome for the patients, but also for the environment. So we need to think differently, how we can deliver, how we can reach the patient where they are, instead of coming to the hospital for treatment. It's a big change of mindset, because when you ask a doctor to change the way to have a visit, moving for telemedicine, it's a big change of mindset. So we know that there is a lot of education on that. So it's on a business perspective, also working with our logistics, with different internal stakeholders to think differently. From an external stakeholder perspective, and you mentioned that, Rémy and Oxana, we are also working with a strong, impactful decision maker. It's not just at government that we need to shape policy, but there is an intermediate level, like cities, for example, or local communities on territories that we can move forward. And so we ask them also to innovate, to think the city completely differently.
Yep.
It's a way that we can change collectively with, once again, the coalition that we may put in place, the way to think how we will live in society in the future. It's long-term, short-term, but we need to make this move. Once again, if we don't change that, we will face issues with some government institutions to change this mindset, to think differently, the way that the population could survive in the future because of the effect of the environment. So innovation is key, having the right people at the right level, at the right place, and hearing from the others. We do not say, as we say in French, on ne détient pas la vérité, so we need to discuss, and so this is the best way to move forward.
I mean, that's amazing, and thank you for that. And it feels like, you know, this is the heart of everything we're doing here, and what ChangeNOW is convened to do is to drive systems change. This is paradigm shift stuff. This is not kind of evolving and, you know, carry on and leave the room and carry on how we're doing and slightly change. This is proper systemic change, and it's amazing to see that leadership in there. So thank you.
And it's a collective. It's not
exactly.
one organization. It's absolutely collective.
Briefly on innovation, Oxana and Rémy, but we've got not much time, so.
Yeah, so we think that actually in terms of, if we speak about financing or if we speak about policies, the solution exists. In terms of financing, probably there is not much of innovation which is needed, but what we need is the scalability of the business models which do exist and the replicability across the countries, across the different sectors. So we are working on that. We are working with partners on how to replicate the existing solutions. One example is nature-based infrastructure, which has been existing for years and years, but now we are thinking how to really scale the financing of nature-based infrastructure. How can we use it to complement the grey infrastructure for the resilience, for adaptation of the hard grey infrastructure, and how to finance these business models without increasing the cost for the users, but improving the returns on the investment and improving the cost of running an infrastructure project, but also bringing co-benefits which have a strong public good effect.
Great, thank you. Shall we, I think we're going to go to my final question, which I like to have because it's important. In the spirit of collective action, I'm going to ask you to talk to your audience. Thank you for listening, all of you guys. And we've got the fireside chat afterwards, so don't leave. But what's the one thing you would like members of the audience to do when they leave here after ChangeNOW? Oksana.
You can come home and see what you can adapt in your house, in your apartment, wherever you live. What can be done to change now, adapt now to avoid the higher cost in the future.
Brilliant. Rémy?
Yes, I think you can start with asking us a very basic, simple question. What is the cost of inaction on one of your key assets? It might be in your portfolio, in your business, it might be your home. Climate risk as an address, and the good news is that we now have the tools to quantify it, but not only quantify the cost of inaction, but also the benefits of action. And once climate risk and adaptation solutions are integrated into financial decision making, capital can move, and when capital can move, then change can happen at scale.
Very good, thank you. And Sandrine?
So once again, solutions are there, funding are there, so now we need to dare to move forward. So walk the talk collectively.
Very good, thank you so much. So please give a great hand of applause for Sandrine, Rémy, and Oksana. Thank you for an amazing panel. Thank you. I'll let you guys leave the stage, please, and then I'm going to welcome my next speaker. I'm very excited about Martin. Please don't leave, because this is going to be very, very good. Martin is one of the leaders in insurance in the world, and I'm going to welcome him on stage and then do an intro. Please welcome Martin Powell. How are you doing? Here we are again. So, Martin, you have been the group sustainability director for AXA, and you have been since 2023. So, you've had 3 years in the job. It's an amazing company, a huge company, and before we sort of dig into what you're doing in the insurance space, which seems to be a red thread through all of this dialogue and conversation, tell me how you got to this part of your career, and you trained as an engineer, I know, but give us a little bit of context.
Great, thank you. It's not a fireside chat, it's a job interview. By the time.
I don't know what the job is.
So I am an engineer.
Yeah.
I think in hindsight, I would have studied history or religious studies or poetry, because throughout my career, I've realized that the ability to write, the ability to tell a narrative is really, really important. And so I worked in the environmental space my whole career, and then in 2008, I became deputy mayor of London for Boris Johnson. I always check where the exits are when I say that.
Yeah.
I didn't vote for him, by the way. But it was an amazing moment for me to spend a term in office looking at how people live in cities, how people react to policy, how you shape the future of a city. And I was then lucky to work with a big tech company modeling the role of technology in cities across the world. So it was a really fantastic moment. And then I landed here in AXA, realizing that if we don't de-risk investment faster and put money where it's really needed, it just seemed like a really great natural progression for me.
Fantastic. Thank you for that intro. We were hearing yesterday one of the speakers called insurance a core bastion of societal resilience, without which it collapses, which is a bit kind of stark. But actually, when you think about if you can't insure your house or your car, and you can't then get a mortgage and all of those things, how have you thought about the strategy at AXA since in your tenure, and how are you thinking about it and building that kind of starkness in?
So when I joined 3 years ago, AXA, like many companies, were very focused on carbon reduction, carbon emissions, which is really, really important. But we're a big insurance company. I mean, we can look at the future. We can think about what is going to happen to society and try to really address those risks, And so we pivoted completely the strategy to focus on climate transition and really walking with our customers, but also how we adapt to the impacts of climate change today. And I'll give a great fact, actually. The World Economic Forum say that the annual cost and loss due to climate change is about $3.1 trillion per year from now to 2050. And a lot of people ask, who's going to pay? Who's going to pay for that? And it's the wrong question, because we'll all pay, all of us, society will pay. And all we do as insurers is mutualize that cost. So the real question should be, how do you bring that figure down? How do you reduce it? And if you invest €1 today in adaptation, it'll save you €8 in the future. So why aren't we beginning to think about spending that money today, knowing that it's going to save huge, huge sums of money in the future? And really, that's where we focus our strategy.
And are you finding that people are ready to listen to that and to act on it, or is it not? Because I guess that has a direct impact on the premiums people are paying and all of that. So you are actually in quite an important, powerful position to influence. And how do you take that? And before you answer, I'm just going to say, what we just heard, you brushed over it, but you changed the strategy of a massive insurance company to look at the future rather than look at the past. Another huge, amazing achievement, because I think there's 150,000 people working at AXA, so congratulations. I think he needs a round of applause for that, because this is forward-thinking business on stage at ChangeNOW, and we had Sanofi, and now we have Martin. But I wanted that to just recognize that. But talk a bit about the question, if you can remember it.
Well, I'm glad the strategy worked, otherwise I wouldn't be here. But
Exactly.
But the people are now aware of adaptation. You heard from Kathy earlier, 500,000 people a year die from extreme heat. It's a huge number. It's not a small number. It's a incredible statistic. People's houses are being flooded more frequently. Businesses are being hit by storms, and they're going out of business because it's happening twice a year instead of once a year. So people are now feeling the real impacts of climate change. So of course it resonates really well. We're also seeing and again, Kathy mentioned parametric insurance. We cover workers in Hong Kong with extreme heat coverage. We also cover environmental assets. So the Mesoamericana reef that runs down the backbone of South America, we have a parametric trigger for the reef. So when a storm comes, the reef gets covered with silt. And if you don't clear it quickly, then the sea life disappears forever. And 90% of sea life live on coral reefs. So, you know, they are critically important for the ocean. And we're going to see more and more of this. I think the speed of addressing disaster is critical. And you know, we really want to think about scaling up both how we protect our environment and nature, but also how we protect the workforce and people as fast as possible. And I think this is the secret of good parametric insurance.
Brilliant, thank you very much. I want to switch to talk about cities. Martin wrote a book called The Climate City, by the way, which if anyone's interested, they can buy on Amazon or somewhere, I guess. Probably shouldn't mention Amazon, in a good second-hand bookshop. But I lost my. So we talked about sort of the impact that cities can have, and we also had a great conversation about China and some examples you've seen which seem to be quite hopeful and positive. So maybe you could elaborate on that a little bit, Martin, please.
So I wrote a book available in all good bookstores. With Christmas coming up, you know, nothing says I love you than a good book.
A double plug.
Thanks for mentioning it. So, you know, cities act much faster than national governments, and you heard in Freetown they have a chief heat officer. There are now 100 cities through the Resilient Cities Network that have a chief resilience officer. You don't see these roles in national governments. You don't see people who are thinking about the business case for how you keep a city livable or future-proofed or protected for years to come. So it was very intriguing for me to write this book because it gave me a sense of how cities can drive that change, how national governments can perhaps follow the blueprint of that. And then I discovered in Shanghai, they'd managed to build a business case and raise $30 billion to future-proof the city against flooding, against extreme heat. Using nature-based solutions, they put flood protection, flood barriers, they put canopy to reduce the heat effects. Really amazing. So somebody in the city managed to build a business case, managed to convince somebody to spend $30 billion today to save 10 times that figure in the future. Why aren't we doing that at a national scale? I don't know, but at city scale it seems to work. And they can price in all the externalities, the impact on health that you can prevent, the impact on the economy if businesses have to leave. And now they're doing this all across China. They're called sponge cities, so there's many examples. So I'd love to see more of that in Europe and in the Americas. I think there's a lot to learn from keeping a city livable and how you build the business case for that future.
So I love the term sponge cities, and I guess that relates to the flooding situation. So, and that would then make those places much cheaper to insure, right? So So the impact, and that will be priced into the business model as well.
Again, the point is to keep the city livable, to ensure that the future risks, the cost is minimized, and then everybody is paying less.
Yeah.
Yeah.
So I think there is a whole kind of thing which is around shifting this narrative to be about value creation. So how do we create value from this adaptation imperative, and how do you build, wealth and well-being and all of the things that people want, through this movement of adaptation. And when again looking at the pitches, there's lots of guys there talking about, this is going to be a great business, rather than a very going to optimize financially as well as for other reasons. So that means this is a bit more optimistic. Talk a bit about innovation that you're seeing, other innovations that you're seeing in adaptation, anything you're doing. You talked about parametric. Do we think that the insurance market will be a big leader in the change, or more of a follower?
I mean, a lot of people talk about innovation. Cities definitely do lead it. People talk about we need more technology. I'm not convinced. I think the technologies exist. We need to de-risk them a little bit to ensure we can deploy them faster. But innovation is about people. It's not about technology. Innovation is about having the right minds and the right people coming together, thinking about a problem and a solution jointly. And you mentioned collective action, but technology is not the answer. We shouldn't be looking at it. We should be looking at the problem right in front of us, and then just jointly figuring out how to solve it. So that's why I go back to my engineering. I don't regret it. I had to learn to be a writer, but the critical thinking that discipline gave me has been instrumental in where I am now.
Yeah. No, it's that sort of formation is, it's lifelong, isn't it? Talking a bit about education, actually, quickly before we've only got 2 more minutes, but there is a thing about how do we get this message across? Because I sometimes think that we've got a great audience, but we're all here because we kind of believe in this stuff, and more broadly, it's tough. And how much are you doing that at AXA? How are you kind of encouraging young people and people coming into this debate, and how do you think about that? I know you.
Yeah, no, I mean,
big part of your role.
I was in Italy last week. We have a partnership with Bouttier-Stref in Milan. We bring 30 of our business leaders from around the world, and we immerse them in the topic of both environmental and social sustainability for those 4 days. And the idea is we ignite them and send them back with a new mission to embed what they're learning into the products that we have. I mean, in AXA France here, we have something called the Green Guarantee. So we encourage people to replace their gas boiler with an air source heat pump, and we pay half of that uplift cost.
Wow, great.
We are, on the social side, we now have a domestic violence guarantee. So now we, within the same home insurance offer, an abused spouse can now enact the policy and be given emergency relocation within 24 hours. So we're really beginning to think, it's superb. Thank you. And we're really beginning to think about how we reach not the people here who are completely convinced by these topics, but by people who really haven't been exposed to environmental or social sustainability. And one of the big things we're working on at the moment is how we revisit the social contract. What's our relationship with government? What should government be providing? My parents are older than their parents were. I'm wealthier than my parents were when they were my age. And my children will be poorer when they finish university than I was in their age. So just in 25 years, we've seen a big shift in the social contract, and we want to think about how we can provide equity across those generations and use our role as an insurer to revisit that contract.
I mean, that's very encouraging to hear, and thank you, Martin. We are almost out of time, but I'm going to let you answer my favorite question, which is in the collective action. What would you like, looking to our great audience, and thank you for being an amazing audience, by the way, what would you like these guys to do when they leave ChangeNOW?
Other than buy the book? No.
And make sure you're with AXA, I guess.
I always say to people, be authentic. Do what you want to do. I'm not very good at recycling, and I don't do it very well. Apologies. But I have an all-electric house. I also have a well, which I use for grey water use. So that's important to me, so that's what I've chosen to do. And then in my job, I've chosen to focus on where I think I can have the greatest impact. So I guess what I'm saying is just do what you think works for you, be authentic, but then go ahead and do it. I think a lot of people are told or asked to do things. I think it's better to just come up with it in your head and then go ahead and do it. So
Brilliant.
That's probably my message.
Thank you. Okay, well, go ahead and do it, guys. But thank you so much for being here. Thank you to Martin.
Thank you very much. Thank you.
And thank you to everyone for a great session. Well done. Yes, thank you.